Good morning. Thank you for coming to this presentation on COVID safety as well as PPE or personal protective equipment. We're hoping that it is helpful for you. COVID is rapidly changing, always changing, and so it's really important to be able to keep up on all the facts, and we're really glad that you're here. My name is Laura Miller. I'm the Chief Medical Officer at Community Health Center Network. I'm a primary care internal medicine physician, and I work both at Community Health Center Network and at Lifelong Medical. I've been seeing primary care patients at Lifelong since 1999. So here we go. So our goals for today are to learn about coronavirus or COVID-19, how it's transmitted, how to recognize symptoms, and how to keep yourself and your clients safe. This information is constantly changing as the situation changes. What is true today may change by next week. And actually, it's fascinating. I last refreshed this PowerPoint in May, and things have radically changed in our understanding of the disease. So yes, indeed, it's true. Things are changing. So just to review, I think most people know this, but COVID is a novel coronavirus. It appeared in Wuhan, China in late 2019 and has really had a rapid spread across the world, as we know. The disease itself is called COVID-19, and the World Health Organization declared a pandemic on March 11th. We in Alameda County went into shelter in place on March 17th, and we've really been living with this virus in our communities, wreaking havoc since that time. The disease, how it presents itself, the disease ranges from mild viral illness, a little bit of aches, a little bit of fever, to incredibly serious illness with acute respiratory distress, where people must be hospitalized in the ICU and on ventilators. It really has a wide variety of manifestations. About 80% of people have mild disease, thankfully. 14% have severe disease, which is defined as needing oxygen. If you need oxygen, you should be in the hospital. And critical, about 5% needing ICU care. And the overall case fatality rate is about 2.3%. So it is a definite contributor to what we call excess mortality. If we look at general deaths in the country or the world last year compared to this year, there is an excess number of deaths, most attributed to COVID. So how has it spread? This has actually been extremely controversial, with lots and lots of information, misinformation, and challenges. So this slide, this graphic here is a very good depiction of what's going on. This is the person with the disease, and they cough. They cough out particles. Some are large and drop to the ground. Those are called droplets. Some are smaller and airborne and don't really drop to the ground. Initially with COVID, we were thinking that COVID was droplet spread, not aerosol spread. Now we really think that aerosol spread is what is going on. So in general, that makes all of our statements about masks more important, because you need to block both the exit of the particles as well as the entrance of the particles into the uninfected person. And it makes the surface cleaning pieces less important, although still important. But at this point, the general consensus is that COVID is primarily aerosol spread. So what are the symptoms? The symptoms are multiple and various. 43% will have fever, 70% will have fatigue, 50% dry cough, 40% loss of appetite. Muscle aches can be relatively prominent. People will get headache, shortness of breath, GI upset, sore throat. And this is interesting here, this anosmia, or lack of sense of smell, is also very important, and it tends to be a pretty clear diagnostic indicator. So if a person has lost their sense of smell, highly likely that it is COVID. Now, if they haven't, it doesn't mean it's not COVID, right? It's one of those things. And as you can tell, these symptoms are all incredibly common. We all have fatigue every once in a while. We all have headache. So it's really very challenging to try to figure out exactly what's going on by the clinical presentation. And to that end, we absolutely need testing. And of course, we're better than we were back the last time I gave this talk. The other thing to say now in October, as we're heading into flu season, is so many of these symptoms are similar to flu. So clinically, trying to sort out what is flu and what is COVID can be incredibly challenging. It's one of the reasons why we're really, really pushing the flu vaccine this year. It is one respiratory virus we can protect people from. So many risk factors make COVID-19 worse. We know, of course, that older age, especially over 65, is a risk factor, as is heart disease, diabetes in part because it in and of itself is an immunosuppressant. It makes people more prone to infection. High blood pressure, any lung disease, including chronic lung disease like emphysema, would be a factor, as well as cancer, chronic kidney disease, immune compromise, and extreme obesity. So all of those things can make COVID worse. That said, we are absolutely seeing young people get COVID and die. So it's not like being young is a protective factor. Being old makes it more dangerous, but being young does not protect you. So I put this slide in because in part, I think it's really helpful to see where we are in terms of our history with COVID. So this is data just from October 12th, so just a little bit ago, the Healthcare Services Agency's presentation to the Alameda County Board of Supervisors Health Committee, looking at case rates, per 100,000 residents. So back in May, we were sitting okay. And then we really had a huge increase and really peaked in July with a little peak in mid-August. And thankfully, we're coming down. So now, this last data goes up to September. Our cases are much lower, which is good. These lines here are the state defined tiers. So the higher the tier, the more restrictive all the restrictions are. We are now in the orange tier, or we've been declared into the orange tier. So it does mean that the county can open things up a little more. County public health is going very slowly and deliberately with this, which I think is a good thing. But in essence, this shows us where we've been with regards to COVID cases in our county. Health disparities are tremendous with COVID, absolutely tremendous. So this shows it's the same source from the Health Committee presentation. This breaks out COVID cases from May to September based on race and ethnicity. So the blue line is the Latinx community, deeply, deeply affected by COVID. Very high percent positivity of the tests that people take. Black Americans, African Americans, the red line, so definitely affected, as well as Asians, the purple line, and whites. Thankfully, everybody is trending down here, but again, there's this disparity here in terms of cases. So the Latinx community, highly hit by disease, although we can't leave the topic of disparities without noting that death rates are much higher in Black people. So 2.3 times the rate of death for whites. So it is striking and must be said. So definitely COVID affecting people of color much more. Latino community in terms of getting the disease, and when Black people get it, a much higher risk of death. And I think so much of the conversation around COVID has been around the structural determinants of health. Yes, it's a virus. Yes, everybody can get it, but it affects different communities differently based on our social structures. So something definitely to confront. And we see the disparities here in Alameda County as well. This is from the Alameda County Public Health Department website. I go to this website every day, looking up where we are in terms of hospitalizations and cases. You can see here high density of cases sort of clustered in the Fruitvale. And also here, Ashland, Cherryland, Hayward as well. So very high numbers, very high density of cases here in our poorer communities. There's a good article that did a cross-sectional analysis of COVID cases, hospitalizations, and death. And this is an older article. I believe it's from May, but it's pretty much clear now that areas with a high rate of poverty and the most racial and ethnic diversity have the highest hospitalization and death, whereas richer areas have the lowest. And in New York, what's interesting is even despite the high population density in both places, right? So you can have in poorer areas, people living clustered, if you will. In higher income areas, people are clustered, but they may be all in their own condos in a high rise. So yes, it's a cluster, but people have their own personal space. So again, COVID is shedding an incredibly harsh light on disparities. So we're going to move here more towards the PPE, the safety pieces. So in working with clients, whether they be in whatever setting you're in, you need to ask about symptoms related to COVID. So these are all the symptoms that we've talked about, especially contacts with ill people. I think that's really important. Let me go back, sorry, because we know, given that COVID is aerosol spread, we know that having contact with somebody who is ill does increase your risk. So very important. Again, the loss of sense of smell is there. If it is there, one needs to be highly suspicious of COVID. If it's not there, you still need to be concerned. Okay. When do you need to call 911? When somebody is big sick, basically. If they have trouble speaking in full sentences because they can't catch their breath, that's absolutely a time to call 911. It's interesting. I find myself doing a lot of telehealth, right? So I'm not seeing patients, I'm talking with them. But when I'm talking with them, I'm assessing, how are they talking? Do they have to catch their breath? So for me, I'm just rattling on. I have no problem. But if I had to stop and breathe every once in a while, I would be very worried about me. So again, just thinking about what are the clues that you can get from how your client presents. If they're complaining of chest pain, that's also very important, or confusion. We know that COVID causes a lack of oxygen. And when people don't have enough oxygen, they can get confused. So super important to be really aware of that. So how to keep safe when taking care of other people, getting from home to work, from work to home, and safety at work. Okay, and I'm going to go not as deep into the surface cleaning pieces, because again, that is important and the information is good, but it's given that we are looking at aerosol transmission, really masking is much more important. So before you leave home, wash up well, wash your hands, arms and elbows and face, put on clean clothes immediately before leaving home. Oftentimes people are using scrubs as a way to keep work and home clothes separate. If you're not wearing scrubs, wear clothing that's either short sleeved or you can roll up to wash your arms and elbows. Definitely avoiding scarves and flowy clothing. You just don't want a lot of clothing dripping around. Be able to keep it tight to your body. Minimizing the number of things that you take from work to home. There are times when I've gone out to do work, and I literally strip down. I don't take my purse, I don't take my wallet, I take out just my cards, credit card, driver's license, and go from there. So thinking about stripping down exactly what you take. And then cleaning off hard surfaces prior to leaving home, like phones, purses, and lunch bags, etc. At work, these are really important. Maintain social distance as much as possible, 6 foot minimum. And again, given that we are now looking at fully calling COVID aerosol, the distance is incredibly important. The masking is incredibly important. It's easy to say, my mask protects you, your mask protects me, and it's absolutely true. If you were to be infected, your mask keeps you from spreading aerosols, okay? If you are with somebody who is infected, your mask protects their aerosols from you breathing in. Cloth masks are absolutely fine. They're good for when you're out and about. In the clinical setting, you should definitely wear a surgical mask. If there's higher risk, you should definitely wear an N95. So always, always, always wear a surgical mask. Try not to touch it a lot, okay? Definitely don't, like when you are wearing a mask, keep your hands away from the masks. Use gloves when you're touching a client. Wash your hands frequently for 20 seconds. And so this is just a cute, silly graphic to remember how to wash your hands. So there's the rubbing your palms like a snickering villain. There's the using the back of your hands, spiders on piggyback, rubbing palm to palm, the kissing spiders, rubbing the back of your fingers in the kung fu grip, rubbing your thumbs in the motorcycle throttle, and rubbing your fingertips in the mortar and pestle. So it's pretty silly, but it does help remember to really clean all those surfaces of your hands. So super important. Wash your hands well before eating and keep food areas separate. Really, truly, do not eat in clinical areas. So important. Clean your hands before you go into an eating area. Okay. Disinfect your phones, keyboards, any high-touch surfaces, and wipe down any commonly used surfaces in congregate settings. So how to wear a surgical mask. So you want to clean your hands with soap and water. Take the mask out of the box and make sure there are no holes or tears. Determine which side of the mask is the top. Okay, I see people all the time with the nose gaping and the wire part is down around their chin. No, do it the other way. The side of the mask that has the stiff bendable edge is the top, and you can mold it to the shape of your nose. So important, so important. Determine which side of the mask is the front. The colored side is usually the front, often blue, and should face away from you while the white side touches your face. And follow the instructions for the type of mask that you're using. With ear loops, you want to hold it by the loops and put it around your ears. And then you want to mold or pinch that stiff edge to the shape of your nose. And then always have the mask cover your mouth and chin. The number of people I see wandering around, this is my cloth mask, with it like this as a chin warmer, makes no sense. You want to cover your nose and your mouth. Okay, super duper important. Okay. So we're going to have a quick little video here about how to put on and take off a surgical mask.
next patient has an upper respiratory infection. Sam knows what to do. Sam puts on a mask and enters the room. Sam? Sam performs hand hygiene. Sam secures her mask either with ties or by placing elastic ear loops around her ears. She fits the flexible band to her nose bridge, making sure it is snug to her face and below her chin. Sam knows her front of her mask is contaminated. Sam performs hand hygiene. Instead of touching the mask, she grasps the ties or elastics of the mask, carefully removing the mask without touching the front. Sam discards the mask in the waste container. Sam performs hand hygiene. Great job, Sam.
So thank you so much for looking at that brief video. This was touched upon in the video, but to remove the mask, you want to wash your hands. Okay, you want to take it off, avoiding the front of the mask. Okay, consider it contaminated. So you take off both ear loops, gently remove the mask, and throw it in the trash. Then wash your hands, soap and water or hand sanitizer. Okay. So this is just another nice reminder on how to wear a mask. We'll start here. So clean your hands before and after. It should always cover your nose and chin. Wear it so that that metal piece is pressed onto your nose bridge. Don't touch it. Take it off before eating and drinking. Discard it if it becomes wet or soiled. If you're going to reuse it during the shift, store it safely and get rid of it when you're done, when you leave the building for the day. All those things are really, really important. For gloves, you want to wear gloves if you're touching a client. If you're not touching folks, wash your hands frequently and clean surfaces frequently. And also clean to include door handles, countertops, pens, and clipboards. So when you take off the gloves, you're going to use the technique called glove to glove and skin to skin. So with your left hand, you're going to use your gloved fingers to pull off your right glove. So pinching it and taking it off. Okay, then this hand is free. Then you're going to slip your finger along your wrist and take off the glove skin to skin. So we're going to play the video. The nice gentleman will do a better job than I.
Now let's take a closer look at proper glove removal. Remember that only skin touches skin and glove touches glove. And if we follow those principles throughout this step, even if you forget the exacts, it should keep you safe and protected from any kind of cross-contamination. When we're taking off the gloves and they're contaminated with either blood or other potentially infectious materials, we're going to grab close to the cuff of the first glove and pull it away from the hand. Slowly untucking and unpeeling that hand away from the other gloved hand, we wad that dirty glove up into the palm of the gloved hand. Now, following the skin-on-skin rule, we go underneath the first or the second glove and untuck that, which keeps the contents on the inside clean on the outside. We can now dispose of this in a regulated waste container and then move to our next step, which is equally as important as the personal protective equipment, and that's washing our hands properly.
So hopefully that video was helpful. At the end of the day, prior to leaving work, you're going to really want to do the same washing thing again. Wash your hands, arms to elbow and face. Disinfect surfaces of objects that are going to be taken home, like purses, lunch bags, anything like that, and then wash your hands again. If you're changing clothes at your place of work, you can take off your work clothes, put them in a plastic bag, and wash your hands again. And then you would put on clean clothes to wear home and leave. You wouldn't want to sit back down while wearing your clean clothes. At the end of the day, going home, if you're going home in a car, you would want to wipe down your high-touch surfaces. If you're on public transport, you're going to want to clean surfaces that might have touched the bus. If you can't change clothes at work, change clothes on coming home immediately, prior to hugging family members, sitting on furniture, okay? You can consider changing in an open air space or a garage, throwing your clothes in a plastic bag, and then washing your hands again. Oftentimes folks will change on the back porch, run through the house, maybe have a robe right there, but run through the house, take a shower, and put on clean clothes. Regardless of whether you changed on the porch or at home, once you're home, you can put the dirty clothes bag in a specific area, and you can wash the work clothes with other clothes. Just use hot water and a dryer on high. So main messages for keeping clients safe. If anybody's sneezing or coughing, cover your nose or mouth with a tissue or use your elbow. Absolutely important. Wash your hands often. Wear a mask. We would be in such a different place with regards to the pandemic if we had started consistent public messaging about masking sooner. When you are around others, wear either a cloth mask if you're out and about in social, or in a clinical setting, wear a surgical mask. Clean and disinfect surfaces, and at least 6 feet between people. Physical distancing is incredibly important, incredibly important. And I think really the combination of masking and physical distancing are really probably the most important at this stage of the game with our understanding of COVID. So a lot of this is about cleaning and disinfecting. It's pretty common sense. I'm not going to spend a lot of time on it because, again, compared to when we first were learning about COVID, given there's less emphasis on surface risks, but it is important to frequently clean. So you want to wear gloves, use soap and water, then a disinfectant. And really routine cleaning of frequently touched surfaces is really important. This is just some more detail on disinfectants that can be used, including household disinfectant, diluted household bleach can be used, and also alcohol solutions with 70% alcohol can also be used. For soft surfaces like rugs, floors, and drapes, you want to clean the surface with soap and water. And you want it for laundry, and I had mentioned this earlier, you want to use, wash everything according to what the manufacturer says, but use the hottest possible water and dry everything completely. So that is that piece. Electronics, you definitely should consider putting a wipeable cover on electronics. And it is okay to use alcohol-based wipes or sprays on electronics and dry the surface thoroughly. So food handling, I think we've really had a lot of change here. Again, because of how COVID is spread in terms of aerosols, you worry that somebody will breathe it out onto the food. So no more potlucks, no more communal food unless you're in your COVID pod and everybody trusts that they are keeping as safe as possible. So single-use items, prepackaged things. If there's a meeting, prepackaged sandwiches, etc., you just don't want to be sharing food. Washing hands before eating, and then increased cleaning and sanitizing of hard surfaces. And that is the end. So as always, deep gratitude for the work that you all are doing. We are in this for the long haul. This COVID started in March. We're now in October. Some estimates are saying we'll be in this at least another 6 months to a year. It's going to take time. So really what we need to do is all take care of each other and the most vulnerable in our communities to the best of our abilities. And I am super happy to answer questions. And again, deep gratitude for the work that you're doing for our communities. Thank you.